We have the first presenter, Dr. Mallika OU, on diabetic retinopathy awareness among healthcare professional students in Kerala.
Good morning. My study is on diabetic retinopathy awareness among healthcare professional students in Kerala. So India has about 74.2 million diabetic patients in 2021, of which it will reach to 129.4 million by 2045. According to International Diabetic Federation, India has the second largest diabetic population in the world. 1 in 6 patients with diabetes have diabetic retinopathy. Currently, 12.5 million people are suffering from diabetic retinopathy. The current rate of blindness due to diabetes is about 7.7%. So in a study by what about Kerala? In a study by Ramesh Hossain et al. Conducted in Kerala in a Chekamanad Panchayat, of which 1,538 people known to have diabetes, only 40.7% had good knowledge about diabetic retinopathy. Only 9.6 had undergone screening for retinopathy, and only 36.4% of our people said that they had some information from their treating doctors. Here is the importance of awareness creation among healthcare professional students who are going to treat the diabetic patients irrespective of their specialty. So why this study? As the first point of contact for a patient is a physician who treats the diabetes, it is their duty to educate the patient regarding diabetic retinopathy. Enough and more studies are there showing the lack of patient education by physician. This study looks at the lacunae in diabetic retinopathy awareness among healthcare professional students. So the objective of the study was to assess the awareness about diabetic retinopathy among the healthcare professional students, and this includes MBBS students, BDS, paramedical, nursing and pharmacy students. A Google form which was properly validated 25-point questionnaire was prepared about the demography of the respondents and awareness about the diabetic retinopathy, and this was circulated online amongst different medical colleges inside the Kerala. A total of 1,205 students responded to the form. 983 were MBBS students, rest were BDS, nursing, pharmacy, paramedical students. 7 students were type 1 diabetic on insulin. 916 students had some relatives or friends as diabetic. We did a subgroup analysis of the students with and without diabetic relatives and awareness of diabetic retinopathy. Generally, all students used to check their eyes only when there was an eye problem, about 66.9%. 20% of 7 checked their annually because they are myopes. 93.9 knew that diabetes can affect the eyes. Regarding the treatment, 38.6 did not know anything. 20.6 thought laser is the treatment. 6.2% thought injection is the treatment, and 22.8 mentioned surgery as the treatment. 23.7% thought an individual with controlled diabetes can avoid regular eye checkups. 26.4 thought treatment can restore the normal eyesight in diabetic retinopathy. 38.8% did not know the answer. 70.4 thought that the diabetic patients are not doing eye examination due to lack of awareness. 10.8% thought it is because of the financial reasons. Only 36.6 knew the simplest and cost-effective method and detection of diabetic retinopathy is dilated fundus examination. 42.9% did not know anything. 11.4% thought the first screening should be only when there is an eye problem. 42%, 7% knew a diabetic with good vision still can have retinopathy. 40.6% did not know. So we did a separate subgroup analysis. 76.6% of the respondents had some friends and relatives as diabetic patients, and that could be a cause for a reasonably good awareness. But there was no significant association in respondents with and without diabetic relatives. So there are so many important literature which shows the lack of awareness and delayed presentation as the cause for blinding complications in diabetic retinopathy, and targeted educational interventions of healthcare providers' knowledge translates into patient education even in slums like Dharavi. Multiple studies support that physician recommendations are strong determinants of patients' adherence to screening guidelines. A study by Rajiv Raman et al. On general practitioners also highlighted the inconsistent knowledge among them regarding the diabetic retinopathy. So to all these points to the need of targeting healthcare providers, we thought it is better to start young. That is why the healthcare professional students are included. Only the exposure of MBBS students during their curriculum was in social and preventive medicine as part of non-communicable disease and in a short ophthalmology posting. Even though the stages and treatment of diabetic retinopathy are taught in curriculum, no much importance is given for the screening protocols. So our study also shows the lacunae in our teaching systems regarding the awareness about the screening for diabetic retinopathy. So what is there in textbooks? The Parsons diseases of the eye, which is considered as the Bible of ophthalmology, mention a single sentence regarding the screening protocol of the diabetic retinopathy. That is, as therapy of retinopathy will at best stabilize the vision or decrease the rate of visual loss, it is important to screen all diabetics annually by examining the fundus after dilating the pupil so as to institute therapy as early as possible. So to conclude, our study shows the importance of including screening for diabetic retinopathy in the curriculum for MBBS and paramedical students. Teaching them at student time itself will make them a better physician and help to bridge the gap of the patient education regarding the diabetic retinopathy. We should remember the theme of World Diabetes Day this year, breaking barriers and bridging the gap. So these are my references. Thank you. Thank you for your kind attention.
I have one question for you. When you gave the questionnaires in the medical students, did you select them, say, third year onwards or everybody from
No,
first year?
everybody. From first year onwards, I gave.
The first year and second year students are unlikely.
Yeah.
How did you validate the questionnaire?
I took the questionnaire from the previous from my reference studies, and then majority of the questions were taken by study from Rajiv Raman et al. And
The previous studies were done in India or outside?
Some in India.
And those were done in same population?
No, that is among general practitioners.
So general practitioners, you have taken it for.
Yeah.
How many people did not respond to your questionnaire?
Actually, I gave it to 1,205 responded. I circulated all in all the medical colleges. Initially, I circulated among the government medical colleges, and I didn't get so many responses. Then I asked the my friends. I gave the questionnaire to my friends.
What is the main limitation of a questionnaire survey?
Maybe they may not be responding it properly, or somebody may be giving the answer, we don't know.
Thank you, madam.
Thank you.